Hello and welcome to Enloe's 2021 Quality Summit. I'm Sean Liston. I'm an ophthalmologist in town at the Chico Eye Center and chair of the Quality Improvement Committee at Enloe. The Quality Summit is an opportunity for the whole organization to come together and to acknowledge and celebrate the quality care that we're able to provide our community. It all began in 2009 when we made the decision that we needed to be honest with ourselves about how well we were doing as an organization. We wanted to not only identify opportunities for us to get better, we wanted to celebrate our very real successes as well. We recognized that we needed a clear-eyed picture of where we were, as well as a vision of where we could see ourselves in the future. So we got to work and began to seek out ambitious, one-year goals to improve the quality of care we provide our community. And we did just that. In 2009 until 2018, we held 10 quality summits. We supported 52 major quality care initiatives, with each one promoted by a physician-led, multidisciplinary team. We introduced the Quality Summit Award, given to the most outstanding project of the year. And then the campfire happened. Everyone listening knows how devastating the campfire was to our community. Many of us lost either homes or businesses or knew somebody who had. Many physicians and other providers left our area, and one of the county's hospitals had to close, leaving us to shoulder the burden of care left behind. But we got through it together. In 2019, we had a measles outbreak and a flood impacting our campus. We got through that together. Then 2020 happened, starting with a cyber attack involving local, state, and law enforcement. Then COVID-19, followed by yet another devastating fire in our region. And we're getting through it together. Some might have buckled under the weight of these crises, but our commitment to patient-centered care never wavered. It's been quite a journey between then and now, with the result that Enloe was named in the top 250 hospitals in the country. That's the top 5%. Plus, we continue to earn an A grade for patient safety. These accolades are no accident, and they're not the destination, but they're part of this journey. How does something like this happen? It's who we are and what we do, because it's what needs to be done. Thank you for joining us today to celebrate what quality looks like when an independent, not-for-profit hospital sees what needs to get done and does it. This is a hospital and a community full of people willing to set high goals, and they work hard to achieve those goals. I've asked Enloe's Chief Medical Officer, Dr. Marcia Nelson, to come and share some highlights from this year's goals and projects. Dr. Nelson.
There we go. Thanks, Dr. Liston. And thanks to everyone who's joined us. Behind me, you see 72 posters. And I wanted to go over with you what these posters mean to our organization. They represent improvements throughout the organization, both at the bedside and not at the bedside. We're a learning organization. Improving quality and patient experience is what we're all about. I'm pleased to share just a small sample from these posters behind me. I promise I won't go over all 72, but I also promise I'll talk about this really cool helmet here. Most of our quality initiatives this year fall into one of three categories. The first, patient safety. The second, improving the patient experience. And the third, and certainly the tallest order, is how did we get through the pandemic, which we're continuing to get through, but how did we do it together and partnering with our community? So let's talk about patient safety first. Hand washing. How simple is that? It's one of the most simple things and most effective things around that we can, and it's what we need to do to prevent the spread of infections. But around the world, it remains one of the tallest challenges for organizations and hospitals to achieve. Our infection prevention team led a hospital-wide effort to make sure that that's not the case here at Enloe. With that initiative, we reduced infections caused by MRSA, a really tough bacteria to treat, by 73%. Another project that's really important for our community has to do with opioid abuse. Opioid abuse hits too many people here in Butte County. We created a substance use navigator program, and that helps connect patients struggling with addiction to very special treatment and at no cost. The collaboration is between the emergency department and our case management departments. We identify patients who are at risk, we provide them with ongoing support, and then we help them manage their substance use disorders. The patient buy-in has been fantastic. 72% of the patients who enter this program, they're still in the program 6 months later. Okay, I promised you I would talk about this really cool helmet. This is one of our Enloe Flight Care helmets. Flight Care transports patients to and from the hospital via helicopter. When the pandemic hit, they were faced with a big challenge. How do they keep flying patients but do it safely for the people in the helicopter and safely for the patients in this time of COVID? Because you see this part here, the Darth Vader part of the helmet, that usually is just flat, and it leaves not enough room for the protective gear, the masks that needed to be worn for everyone's protection. So they got resourceful. They scoured the internet. They figured out a way to attach this piece to the helmet that's usually used for open-door helicopter maneuvers. And there you go. They were able to fit their PPE, their protective equipment, underneath the helmet and continue flying patients to and from the hospital. So let's next talk about projects that improve the patient experience here at Enloe. The first one that I want to highlight involves mothers and babies. It used to be that if a woman had one C-section, she was going to have another C-section. And a lot of our patients were saying they didn't want it to be that way. They wanted to try having a vaginal delivery. Well, with a lot of collaboration and using a lot of the best science, we're now able to offer that to our patients. And 75% of the women who are trying this trial of labor after cesarean section are able to deliver vaginally. And that's good for the baby, it's good for the mom, and it makes a lot of happy moms and dads. Next, I want to talk about organ donation. Sadly, not everyone who enters a hospital can recover. Organ donation can be a light in the darkness for grieving families. Our critical care team started the Honor Walk as a way to support these families. When a donor patient is on the way to the operating room, the Enloe caregivers line the hallways. It's a silent, respectful gesture that can bring great comfort to the patient's family. And lastly, I want to focus just a little bit on these quality initiatives that had to do with COVID, our journey through that. Enloe's journey with COVID started back in mid-March 2020. Our journey has involved people inside the hospital walls and outside the hospital walls. At first, like most places, we had only a few COVID patients. But after Thanksgiving, that changed. The number soared to 56 at our maximum. For context, that was a fourth of our patients had COVID. Enloe's leadership created a surge plan that helped us prepare for that increase. That included opening a third ICU. And then we wondered, what is COVID going to look like at Enloe? So some of our Enloe team, they created a predictive model that helped us plan. Our formula forecast with great accuracy how many patients we could expect and for how long. That let us adapt our staffing models and know when to open or close that third ICU. And then Enloe worked with the whole community to fight COVID-19. Early on, when we didn't know how many patients were going to be coming our way with COVID, We moved patients out of the Enloe Rehabilitation Center over to the Esplanade campus. We moved our entire outpatient therapies program into the Chico Sports Club facility, which wasn't having people come to the gym at that time. This freed up the rehab center, and we used that as a federal medical site, just in case we needed it to accommodate more COVID patients. It was pretty amazing, and all these changes happened over just one weekend. Another collaboration we had was when our testing supplies were running low. We had to have the liquid that we could store our COVID viral samples in so that we could even do a test, and we were running out of that. So here in Chico, we're lucky to have the Sierra Nevada Brewing Company, and they shared with us materials that they had so we could adapt them and use them to transport the viral tests. That was pretty fortuitous. And when we needed personal protective equipment, our community came to our help, and they sewed thousands and thousands of masks. And then finally, vaccines. When we needed to get vaccines into people's arms, more than 130 people volunteered to help run the community vaccine clinic. They used space donated by Dan Gonzalez, the developer of the Miriam Park community, seeded with a $750,000 matching grant from Ken Grossman and his wife, Katie Gonzer. Many community business leaders stepped up and donated over $1 million to help us with our vaccine efforts. It helped Butte County early on stay ahead of a lot of other counties in getting those vaccines into arms. And in addition to these defensive measures against COVID, we also began offering monoclonal antibody therapy. That was in late December. It had only been approved for about a month. This was a treatment that could help improve the health of people with mild COVID illness. And we found that by getting that treatment into people, we were able to decrease the rate that they were hospitalized by about 50%. In the December and January period of time, when we were having those high surges of patients, that was very, very important. I'm really proud of all these accomplishments that everyone throughout the organization has done. And so what I'd like to do now is introduce Mike Wiltermood. He's Enloe's CEO, and he'd like to recognize some folks for their amazing work over this past year. Mike?
Thank you, Dr. Nelson. At the risk of repeating a few things that have already been said, I appreciate the opportunity to maybe put some additional context to the amazing accomplishments that you see behind me. Many of you may remember that elegant dancing couple, Fred Astaire and Ginger Rogers. On one occasion, when Ginger Rogers was asked what it was like to dance with Fred Astaire, she said, "He's a wonderful dancer, but I have to do everything he does going backwards and in heels." To me, you can multiply that by about 1,000, and you get a rough idea of what it's like to run a hospital in the middle of all the disasters and challenges that we've faced over the last few years. I think that our Quality Summit would be looking very different if it hadn't been for the many people who helped us in our disaster responses. No award can adequately recognize those who have been on the front lines, directly taking care of our COVID patients. Nurses, doctors, ancillary staff, admitting, screening, security, environmental and dietary services. The list is long, and I need to apologize for not mentioning everyone by name. No award can adequately recognize those who labored in the background providing support to the frontline staff. In the middle of tremendous shortages of protective supplies and equipment, essential medicines and lab testing, our procurement, pharmacy, and lab departments did a yeoman's job, keeping us as stocked as possible with life-saving supplies. And we will be forever grateful to those in our community that Dr. Nelson already mentioned, who donated supplies, volunteer hours, and financial aid. During the pandemic, as Dr. Nelson mentioned, we were able to set up a 128-bed field medical site to handle the anticipated surge of COVID patients last spring. We were among the first to mobilize a monoclonal antibody infusion program, and our vaccine clinic was among the first and most effective in the state. Much of our pandemic response was dependent on our engineering department. I'm mentioning them because they always get on my case when I don't mention them. Which, in addition to setting up our field medical site on 24 hours notice, did everything from moving in a modular emergency COVID clinic to brightening our holidays with the best light show in town. We also had many others who worked tirelessly in leadership, whether it be our medical staff or our command center. People who provided direction and moral support and kept us informed and communicating, lest we become overwhelmed by the uncertainty and challenges we were facing. And this is just one disaster. There are just too many to recognize in this setting, so let me just say this. What you have accomplished over the past 3 years in the wake of fires and floods and pestilence is nothing short of a miracle. Many, perhaps most, organizations like ours would find disaster response to be a justifiable excuse for putting quality and safety initiatives on hold. But this summit says otherwise. Everyone, whether on the front lines or in a supportive role, owns a piece of the tremendous progress we see here today. And once we get this pandemic more firmly behind us, I hope we can take some time to finally recognize and celebrate the great work that has been done. During the campfire, our operations continued to run so smoothly that one of our patients remarked, "If I hadn't seen the fire and heard about the evacuation of Feather River Hospital on TV, I never would have known it was happening." This is the kind of organization we have. I want to commend all those nominated for our annual Quality Summit Award and express our deepest gratitude to the rest of the organization for your constant effort to meet our mission. And in spite of the challenges, maintain our laser focus on patient quality and safety. I can't imagine where our community would be without your sacrifice. Thank you. Now I'd like to turn the time back over to Dr. Sean Liston.
Thank you. Thank you, Mike. I like the helmet. Looks like one of those helmets that they wore when they were firing off the Death Star. It is now my distinct pleasure to announce who has won this year's Quality Summit Award. And it comes out of the Nettleton Mother and Baby Care Center, and it was something that Dr. Marcia Nelson also alluded to in her remarks. It was the quality report about the trial of labor after cesarean, TOLAC, report that was brought forth by Dr. Raleigh Unterseer, Dr. Alicia Wenberg, Sandra Bernstein, Tammy Newsom, and Nancy Gagan. And so I would appreciate it if they would come up here and we could thank them for the hard work and the tremendous sacrifices they have made in bringing us this wonderful information. Thanks.
I'll wait for everyone to gather because this is a team, and it's a great honor for our department to be recognized over and above all these fine projects that we see behind me. We were committed to delivering health care, and especially healthy moms and healthy babies, and we knew that we could do that with less trips to the operating room. So we did our project to say, let's do as many vaginal births and avoid C-sections in our women that had previously had C-sections to the safest degree possible and as often as possible. And I'm happy after years of these comments, well, you can't have a VBAC at Enloe, we can say you can have a VBAC at Enloe and you can have a safe one, and I'm very proud of that. And a shout out to all the rest of our doctors and our staff for pulling this off. Thank you.
All right. Thank you so much, and congratulations. And I also forgot to mention Dr. Mark Schwalbe as well. So next we're going to be discussing quality for the future. As I mentioned in my earlier remarks, this is something that is part of a journey. We haven't arrived at our destination. We need to continue to bring quality for our patients and continue to try to take care of our community. And so the two initiatives that we're going to be bringing back over the next year are first to reduce our readmission rates for heart failure by 20%, as well as to have zero patient safety events related to communications barriers. So these are the two one-year quality initiatives we're bringing forth because we want to take some bold steps and work to provide better care for our community, as we've done for the past over 10 years now. And with that, I believe we are bringing our Quality Summit to a close. Once again, I want to thank everybody for joining us on Facebook, everybody that's here observing us as we're celebrating the quality care we provide our community, as well as those of us who've demonstrated tremendous excellence in the care that they've provided and what they've been able to report back to us on the improvements they've made to provide better care for everyone here in Chico and the surrounding areas. And with that, I think we're done. Have a good night, everybody.